your girl Bree Nicole, and I'm back with another video. And in this video, I'm going to be giving y'all a 6-month update on my registered nurse position on a Med-Surg / Oncology unit. I've actually been a registered nurse for about 7 months now, so I'm a little late to recording this video, but I just want to get it out there to you guys. I am still in my nurse residency program. I don't know if I told y'all about that, but my hospital automatically put new grads in this nurse residency program. So you don't have to apply for it or anything. They're not limited to the number of people. If you are a new grad, you are automatically placed in this program, which I think is a good thing. So the program lasts a whole year. So I only have since I've been a nurse 7 months, I only have until my nurse anniversary to be done with the nurse residency program. So I'll talk about that a little bit later. But I started in July as a registered nurse. I was with my preceptor I think I was with her for like 8 weeks on orientation. So first things first, you had to attend 2 weeks of nurse residency, new grad boot camp. That's what they call it, new grad boot camp. So what we did, they divided us up into like clinical groups, kind of like nursing school. It was like 8 of us in a group, just depending on how many of us got hired at the same time. So we were divided up into different groups, and the first week, a group of us went to the ER and worked 8-hour shifts for the whole week. So we worked in the ER because they wanted us to see a lot and do a lot of skills, because they know that we were in nursing school during the pandemic. So we didn't get to do a lot of skills and stuff in nursing school. So we spent that whole week in the ER inserting IVs, inserting Foleys, doing dressings, just whatever, helping with codes. Everything that came into the ER, we got to do it. So that was a really good experience. Even though I really didn't want to work in the ER, they made everybody do it. So, and then the next week we worked on Med-Surg, and we actually worked on my floor that I'm currently full-time on, which was a good thing. So I got to know the nurses and staff and everything before I actually got up there. So we did a week, 8-hour shifts, 7 to 3 on my floor, because it is a Med-Surg, like fast-paced type of floor. So we got to do a lot of things up there as well. A lot of dressing changes get done on my floor, Foleys, all that type of stuff. The 3-way Foleys, just a lot of different stuff up there. So we also got to practice a lot of skills up there as well. After that, we each went to our floors, got with our preceptors, and worked 8 weeks. And you could work an additional, I want to say the hospital said we could work anywhere from 6 to 12 weeks with our preceptor, but I worked 8 weeks because after that I felt more confident, and my preceptor also felt more confident in me as well, for me to go on my own. So after that 2-week period, I got with my nurse, and I was with her for 8 weeks. And she was a great preceptor. She had been a nurse for, I want to say, she told me she's been a nurse like 10 years. She had always been an ER nurse. So she always was about like the fast pacedness of the ER. But then she just decided she was tired of the ER. So she just wanted to do something where the patients are a little more stable. So she came to Med-Surg, and she actually had been on the Med-Surg floor for 1 year when I got with her. But I learned so much from her, tips and tricks on how to start IVs, because she is so good at doing IVs and labs. She was a great nurse, and I love her to death. She taught me so much and made me feel so much more confident. I started off just following her, shadowing her around that first week. And then you know how it goes. She gave me 1 patient, then I moved up to 2 patients, 3 patients, 4 patients, and 5 patients. And on my unit, we only have a total of 5 patients. So I had to take on all 5 patients, before I could be taking off orientation. And then also there was like a checklist of things that I had to check off on before I could actually be on my own on this unit. So I had to make sure I had to do a lot and see like most of the surgeries and the patients that come up to their floor before I came out on orientation. So I definitely saw a lot. That's why I love Med-Surg, because you see a lot. Even though some of the surgeries and stuff can get repetitive, but every patient's different. Every patient has something different going on with them. So you do get to see a lot, and you do get to use like your critical thinking skills, because I've had patients come in for like simple surgeries and end up staying with us a full 2 weeks because they found out about a heart condition that they knew nothing about. So they end up having to get consulted to cardiology. And yeah, you have to use your critical thinking. If something doesn't look right, vitals, labs doesn't look right, just use listen to your gut, contact the doctor, and just, you know, do what you're supposed to do as a nurse. And I also got assigned a coach. So the coach was in charge of just scheduling meetings with my preceptor and the manager. And the coach was just like another backup person. If I needed something that my preceptor couldn't answer, we all were assigned a coach. And my coach had been on this particular unit for, I think, maybe 20 years. He had been on this floor at this hospital. So he was a great coach. Like, he knew everything about every type of patient up there. He was awesome. So when I first started, I met with my preceptor and my coach and my manager, and we talked about just the different things they wanted me to be able to accomplish and do on this floor. And then I met with them like at the halfway mark, once I was like 4 to 5 weeks in, and then I met with them one last time before I came off orientation. So I think that also helped me a lot, because I had questions for them. They were able to answer other stuff that my preceptor couldn't answer, which was really good. So once I came off of my preceptorship, I was so nervous. My first day of work, I want to say I worked like a full week with her, and then the next week I started off on my own. I got with the scheduler. On my unit, we only have to work 3 days a week. So she just told me to pick 3 days for the remaining schedule. Pick 3 days that I can come into work, and then they just worked me into the schedule. So I picked 3 days, and then I came in. I got my own set of patients, and my first day actually went well. My patients were like stable, like nothing was going on. My manager, my coworkers constantly checked on me to see if I needed anything, but my patients were great. I want to say I had like a first good week. My first week was actually really good. The second week I got floated. So I was really nervous about that, but I did get floated once while I was on my preceptorship. So at my hospital, you can get floated to other units, like sister units, nothing critical. So the renal floor we can get floated to. So we learn and see a little bit about renal patients that are on like dialysis. So you can get floated to that unit. That unit holds like dialysis patients, renal issue patients, and just like medical patients that come in like for dehydration and just stuff like that. We can get floated to the Med-Surg COVID unit. So like if a patient comes into the ER and they have like a Med-Surg issue going on, but they test positive for COVID, they can't come to my floor because my floor is a clean floor. So there's a Med-Surg COVID floor. So we can get floated there. I've got floated there only twice out of my whole 7 months of being a nurse. And that was actually the floor I got floated to first on my second week off orientation. I got floated to the COVID Med-Surg floor. It wasn't really bad at all. Most of the people up there were asymptomatic. They came in for like abdominal pain and ended up having to have surgery, but they tested positive for COVID, so they couldn't come to our unit. So it was just like taking care of regular Med-Surg patients that had COVID. So we just had to like dress out in the full PPE and everything. So, and then we also get extra pay just because of the people have COVID. So that floor, and then the ortho floor we can get floated to because they're like Med-Surg, but just ortho patients that have like hip surgeries, back surgeries and stuff like that. So those are the only 2 floors that we can float to. And then those nurses can also float to our floor if we're short. So yeah, that's another thing. But I have learned a lot working on this Med-Surg unit. I've seen a lot. Anything you can think of. We do appendectomies, gallbladder removals, colectomies, dealing with the intestines, stomach surgeries, anything just from like here up to here, your belly up to here. We get those patients, and we get so many type of surgeries, thyroidectomies. I've had a patient that had to have like a sinus surgery, that had like a nasal dressing. We see it all on our floor. A lot of dressing changes, and also we get a lot of medical patients. So patients might come in with wounds. We get a lot of sacral wounds, diabetic wounds. Like, I didn't know diabetic foot wounds was such a big thing. I know we talked about that in nursing school, but there was a time where 2 of my 5 patients were on our unit for diabetic foot wounds. They end up having to get like extensive dressing changes done, debridements, even like amputations. I've had below the knee amputations, toe amputations, foot amputations, because of these wounds. And it's like bad. They come in with necrotic wounds. So you get to see a lot and do a lot of dressing changes. And then like with the medical patients, people may come in for like dehydration, electrolyte imbalance. So we just pretty much give them fluid replacements and electrolyte replacements, because they come in with like altered mental status related to their electrolyte imbalances. So that's another thing that we get to see. And since it's an oncology unit, we also get like cancer patients that come in. So if a person gets sick and come into our ER and they're like currently on chemo, we have chemo certified nurses that can administer them chemo while they're like receiving treatment for like being sick. I'm not chemo certified. It's like some like certification that you have to do. So we have, I think, about 5 nurses on our unit that are chemo certified. And you know, I've been assigned chemo patients, so I do get to go in the room and watch them like do things. And when a patient is on like chemo precautions, you have to like double glove. You can't be pregnant with the chemo patient because those drugs are really hazardous. They come out in the patient's body fluid. We get patients that are on like precautions, like C. diff precautions, different bacterial infections. So they're on like contact, droplet, airborne. We get to see like a lot. It's a variety of stuff that goes on our unit, and I felt like I've learned so much being up there. So yes, my 6 months have actually been going good. Other than like having to float to other units that are short, I really have had a good experience at my hospital. My coworkers are great. They're always asking me if I need help. We like help each other out. My techs are great. I've had a great experience so far. And also a little bit more about my nurse residency program. So this program, we meet once a month. We have to be off for these meetings, and our managers are already sent a schedule for these meetings. These meetings are planned out a year and ahead for us already. So we get the calendar at the first meeting. We meet once a month from 8 a.m. to 12 p.m. and we just talk about our experiences. So like some of us are on my floor, some of us are on like ortho, mother baby, ICU, ER, psych, progressive. We just talk about things that are going on our floors and do like little modules and like read through PowerPoints and stuff. And then for our nurse residency project, we have like a final project due within like the last 6 months. They want us to like get with other people on our floor and work together to come up with a project of something that could be changed or something that could be better on your specific unit. So it's 4 of us in my nurse residency program that work on my floor. So we're going to get together and work on the project. And if y'all want to know more about it, I can come back and talk more about like the nurse residency program in detail. So yeah, that's a little bit about the nurse residency program. Yeah, that's pretty much it, y'all. I've had a great experience so far on my unit. It's going good. The cons would really be just pretty much time management. I'm still dealing with, you know, how to get things done in a timely manner. But I do feel working as an LPN at the long-term care facility helped me out a great deal on my time management. So yeah, just comment down below what other videos y'all would like to see from me, guys. Don't forget to like, comment, and subscribe, and let me know what other videos y'all would like to see. I'm so ready to start recording like day in the life videos. Get ready with me, morning routines with me and my kids. So just comment down below and let me know what else y'all would like to see from me. And I will see y'all in my next video. Bye, guys.